And then if your camera and your background is distracting, we ask that you turn your camera off, or we'll have staff actually request that you turn your camera off. So Elena Orozco, she is our staff with us today that's going to be monitoring the participants. So she might ask you to turn off your camera if your camera is distracting in any way. We also ask that if you have any questions for our guest speaker, it's Marilyn Perez. She's going to be talking to us about working as a physician's assistant today in this BizChat. If you have any questions for her or want her to expand on any of her answers, you can ask your question in the chat box and I'll read those things out to her in the video in the BizChat today. Okay, thanks so much. So without further ado, Marilyn will go ahead and get started. If you can share with us a little bit about your background, your career journey, and some of your educational experiences that have helped you become a physician's assistant, that would be great.
Okay. Hi, everybody. I'm Marilyn Perez. I'm a physician assistant here in the Central Valley. I grew up here in the Central Valley. I actually was born in Bakersfield and was raised in Porterville, so right here from this area. I graduated from high school, Menachie High School here in Porterville, California. Went to community college for 2 years at College of the Sequoias here in Visalia, and then went on to graduate with my bachelor's degree at California State College, State University, at Bakersfield. And then I applied for the PA program at UC Davis and got accepted there at UC Davis and went into their, at the time, the PA program there at Davis was housed in the community and family medicine division there at the medical school. Now it's housed at the Betty Irene Moore School of Nursing. So they combined their NP and PA program into one school. Kind of unique going to Davis is that they actually train both physician assistants and nurse practitioners. So I did my training there and then got my master's from A.T. Still University, which is a osteopathic medicine school out of Arizona. And then I've been working as a PA ever since here in the Central Valley. I went into family medicine initially for about 6 years. And then after that, I've been working now in internal medicine at the chronic disease clinic here at Kaweah Delta. I treat patients that have uncontrolled diabetes, that need help managing their heart failure symptoms. And we also do COPD management now too. And I still dabble in some I still do primary care medicine too. So, you know, my path to becoming a PA, I would say, was a little bit circuitous in that I didn't start out thinking I wanted to be a PA. I actually went to school majoring in biology because I really liked biological science. And I also was a musician at the time. So I kind of toggled between the two majors for about 2 to 3 years, kind of undecided. I took some music classes. I took some composition classes. I worked with different music groups. I even did a stint one summer at Disneyland, working as one of the musicians at Disneyland, and working with some of the music groups in LA and in Sacramento. Before I started working as a nursing assistant, and that was kind of my parlay into the medical world, so to speak. I took a class one summer to become a CNA, and just because I couldn't decide what I wanted. I just kept going back and forth. So I took the class at one of the community colleges, and then I started working as a certified nursing assistant part-time at one of the skilled nursing facilities I was like, by this time I was living in Sacramento. I was playing with a group up there in Sacramento, with a music group up there, and traveling all over the state of California. And I took a job working part-time as a certified nursing assistant at one of the skilled nursing facilities, and found that I really loved working with patients. I loved the interaction of working with patients. I loved learning about their medical histories and trying to figure out their diagnoses and why they were on certain medications, and how they became the way that how they were became the way they were. So because of that, I there was a family friend of ours that he graduated. He was a PA and an NP, and so he graduated from Stanford University at the time. Both Davis and Stanford were training NPs and PAs together, and so he was an RN before. And I can answer some more questions about the difference between NP and NPA, because I know a little bit about both professions. But he had been an RN before, and he ended up going to the program at Stanford, and he got both his NP and his PA license. And so I've been talking to him about my decision. I knew I wanted to do something in the medical field, and I really, as time went on, found that I enjoyed that much more and found it more gratifying than just playing music on the weekends, even though I still love to play music. But I found it like I loved working with the patients. And so talking to him about it and trying to narrow down my field, because I thought about going into nursing. I thought about applying to medical school, because my undergraduate degree was in biology. So I was taking the prerequisite courses to go into medical school at the time. I thought, that's what I'll do. I'll start taking all the prerequisites to go into medical school. Just because if I end up wanting to go that route, I'll have all the prerequisites. And then after talking with him and then shadowing him, and then I shadowed a couple of other PAs, one that worked in surgery, one that worked in family practice, I found that it really it matched my personality. I really enjoyed the work-life balance that they had, watching the other PAs that I got to shadow. And I saw that they still had the same type of like patient interaction that I was looking for. And the encounters that they had with patients were still very like mentally stimulating. And generally were great people going above and beyond for their patients. And I just loved that. So I ended up, deciding on the PA route, because for me, I had already, like I said, was already in the process of completing a lot of those medical school requirements, and was getting my degree in biology. And if I had decided to go into nurse practitioner route, you have to have your RN, you have to have a bachelor's as a registered nurse. So I would have had to essentially go back and get another bachelor's degree. So I decided to go the PA route instead. That's, kind of in a nutshell, my kind of journey into PA, the PA profession.
Thank you. So really fast, then, you kind of touched on it a little bit. The difference between a nurse practitioner and a physician's assistant, is it the educational component?
Yeah.
Is that the difference? Okay.
So both the educational component, you'll hear this a lot, that PAs are trained in the medical, like MD type. It's almost like kind of like a mini medical school. The way they formulate your first year of school is all what they call didactic. It's all like classroom oriented, a lot of pathophysiology. And then the second year of PA school is all clinical, and you have to do 4 to 6 week rotations in different fields of medicine. So they kind of formulate their schooling and the way they conduct PA education is in a short and very condensed kind of the way they do medical school. The nurse practitioners, what you have, the big difference really is they going into become a nurse practitioner, you have to be a registered nurse. You have to come, they treat, or they not treat, but they they teach with using the nursing model. And so they have, you know, a little bit of a different philosophy. And they are all registered nurses when they go into nurse practitioner. So you have to have that, and you have to have that BSN before going into to nurse practitioner program. Typically, both of them are, you know, anywhere from 2 to 3 years. They both require some form of clinical work. I will say that the PA program, usually my PA program required over 3,000 hours of clinical work. So you know, and we had to do a certain amount, and it was full time. You can't like kind of cherry pick when you want to do your clinical rotations, or you know, kind of decide that you only want to do certain rotations. You don't get to do that. They have a very set structure. You have to do so many weeks in emergency medicine, so many weeks in surgery, so many weeks in family medicine or internal medicine, OBGYN, pediatrics. It's very structured in that way, that their clinical rotations are very structured in that way. The licensing is also different. PAs are licensed through the through a national certification process, and NPs also have their own licensing board. So, and then when you go actually to practice, and depending on the state, the PAs also have their own licensing board that you have to apply to license in that particular state, and NPs have their own national and their own state licensing boards. So they're all, you know, those are the kind of, you know, differences. I would say the fundamental difference is really the education going into the program. Like I went to school, my PA program was filled with people that were EMTs. They had degrees in chemistry, biology, physical education, kinesiology. There was a physical therapist in my program. There were 2 people in my PA school that actually had their PhDs, one in physiology, who wanted to do more clinical work, and he had been doing like research, and he wanted to do the more clinical aspect. And there was another one that had her PhD in neurobiology, who the same thing. She had been doing a lot of like you know, scholarly type work, and she wanted to have that clinical component, a clinical aspect. So there was one guy in my class who was a marriage family. He was an MFT. He was a marriage family therapist. So he had his master's already, and he had been working as an MFT, and decided he wanted to do more type of like treatment options. Because typically MFTs do a lot of like cognitive behavioral therapy. They don't dabble in the pharmaceutical, the medications as much. And so he wanted to have that knowledge and have that ability to prescribe medications and work with the psychiatrist. So you'll see that PAs come from a lot of varied backgrounds. A lot of, like, I would say probably a quarter of my class were also military background too. And actually PAs were historically came from the branch, they were from the military. A lot of them were medics. And so, you know, that was actually one of the, during Vietnam, the 1970s, that's actually where the PA profession came from, is that they were you know, coming, there was this, you know, group of medics that were coming home that were trained to do like, you know, trauma type work, and work in hospitals, and work in clinics that were set up by the military overseas, and they needed to you know, they wanted to find work places where, you know, these soldiers could work. And so the PA profession from Duke University was you know, created. So a very varied background. You'll find in PA school, people come from pharmaceutical rep sales, people that just very different types of background.
Sounds good, thank you. You mentioned also when you were sharing some of your background information that you like the work-life balance that was available to you by being a PA. What does that look like?
So I don't get to I don't have to be on call. So I don't have a pager. I go into my clinic at Clinic for me doesn't start till 8. It doesn't end till 5. I go in around 7:30 to kind of review my charts and look at the list of patients that I'll be seeing for that day, review any labs that have been completed or any radiological studies, any imaging studies that need to be reviewed before the day starts, so that I'm prepared for the patients that they come in. But when I go home, after 5:30 and my notes and my charts are done, I don't get called in the middle of the night typically. I will say that's not every PA has that, but and most people in primary care, they work in family medicine or internal medicine, do kind of get to enjoy. They go into the clinic and then they go home, and then they get to put it away. That's one of the things I like. Weekends, I work weekends coverage when essentially kind of when I want to. At my current job, I have worked jobs before where they do require people to cover one weekend a month or something, but those are all things that are negotiable with your employer. But I like that balance. I like not having to be on call and not having to like be called in the middle of the night for things. So
Good. Yeah, I can imagine. I would like that work-life balance too. I don't know if I would do well in a on-call situation. But before I ask your next question, just because we do have a few people who have come on later on in the Zoom meeting for the BizChat, if anyone does have questions, feel free to ask them in the chat box and I'll read them out for Marilyn. I do have a few preset questions that she and I communicated about before this BizChat. So I'm going to go ahead and keep going through these questions that we had predetermined. So let's see, you talked about your typical responsibilities as a physician's assistant. Some of the things that you were saying, you were using abbreviations. You mentioned COPD. I don't have a medical background, so what does the COPD mean?
So the clinic that I work at right now is like a specialty clinic. So COPD means chronic obstructive pulmonary disease. It's just an acronym for COPD. The clinic that I work at now is an internal medicine clinic, and they specialize in patients that have heart failure, diabetes, and chronic obstructive pulmonary disease. So, that's the bulk of the patients that we see there, and the majority of the patients that I see now are patients that are not well controlled. So they still have a primary care provider that they go to, and they still see their specialist, but maybe they have a lot of social barriers to their treatment, to understanding their disease process. So at the clinic I work at now, we do a lot of education. We involve a lot of our social workers to help them find resources in the community, and we help them understand how to take their medicines, because sometimes in primary care you'll have like you only get like 10 or 15 minutes with your provider, and maybe you have like a lot of medications you take, or you have a lot of medical conditions, and so you're not always really sure how you should be taking your medicines, or if you should be taking certain ones together. So the visits that I do now are a lot more, they're a little bit longer, 20 to 30 minutes. We actually sit down. I work with a pharmacist and another internal medicine doctor, and 2 other nurses and some medical assistants. And so we'll actually sit down as a team and we'll go over like every single medication the patient is taking. We'll do a complete chart review of all of their diagnoses, what they've been worked up, for in the past, or their past medical history. So we get a really good, thorough understanding of their disease process and how they came to be the way, how they are where they are, and so that we can do a good job of explaining things to them and helping them stay in touch with their primary and their specialists when they need it, and make sure that they get their medications. And you'll find also too in the Central Valley, I find actually that there is a social component, you know, to medical care here too. People live in the country. There's not a lot of medical providers for them to have. They don't have as much access. People, their literacy level is varied. So their medical literacy level is varied. So you'll see that people sometimes don't understand the acronyms, like, or that they don't understand why they're being prescribed certain medications. And that's not necessarily unique to the Valley, but you know, it's something that is uniquely challenging sometimes in rural settings, as people are so spread out. So you know, people have to drive, you know, they live in smaller communities, their access to care may not be as great, their literacy level, and then of course add on to that the economic, you know, issues too. You have some patients who can't afford their medicines, or so at my clinic we deal with all of that. We will sit there and help patients connect them and figure out and help them get to where they need to get so they can have a better quality of life, and that's really what it's about. Like, you really, you know, there to help people. So
Good, thank you. So then when you were talking about a physician's assistant, I know obviously there would be some medical skills that you would gain through your education, but are there any soft skills or employment skills that you think would benefit students in this career path as well?
yeah, so definitely if you're thinking about going PA route, make sure you get good, you want to get exposure to the health field, really. And that's with any you know, profession in the medical. You want to start to get that exposure to the medical field, whether it's scribing or like becoming a nursing assistant, or an medical tech, an EMT, so that you can see if that's a good fit for you. And also to that confidence in talking with patients, dealing with different personality types. You know, when people are sick, they're not always, they don't always feel their best, and so they're, you know, you have to learn to navigate that a little bit. You know, that people are not going to be happy to see you necessarily. Maybe when they feel better, but and initially they may not be so happy to be there, and to have to be seeing you. So learning those soft skills, like how learning to read people, learning to talk with people, learning to communicate, learning to listen, you know, those would all be really good soft skills that you work to develop. Learning to ask lots of questions so that you know, get to you know, and sometimes you ask direct questions, and sometimes you have to ask like multiple direct questions to get an actual like answer, because sometimes people don't, they're embarrassed, they don't always want to share things, you know, everything with you. So or it comes out in pieces. So you know, those are some soft skills, definitely. Other types of, you know, I think a lot of the clinical stuff you're going to learn in school, like, you know, learning to take blood pressures, and, you know, learning medication management, and, you know, pharmacology and disease process, pathophysiology of some of the disease. You'll learn that in school. But some of those soft skills, learning to talk with people, I think are in, and learning to communicate, learning to write effectively and succinctly, because everything that you do in your medical visit has to be charted and you know, written down. It becomes part of their medical record. It's a legal document. So learning to do that effectively, those writing skills are also important. Yeah.
Good, thank you. We did have a question come in the chat. What personality traits or characteristics would make a good physician assistant, in your opinion?
I think there's a lot of them, but I think empathy is a big one. I think that makes you, you know, the ability to walk in somebody else's shoes and to empathize with them makes you a good provider. And I mean, nursing, PA, physician, I think makes you good provider, a good PA for sure. Learning to empathize, learning to deduce also too is another good skill, because you're going to get, like I said, you'll get pieces of information, that you then have to kind of like put together, fairly rapidly, and then come up with a diagnosis. And sometimes it's what they call a differential diagnosis, meaning somebody may be presenting with symptoms that it could be this, it could be that, it could be like multiple things. And so you're almost like honing in some of those investigative skills too. So if you have to be curious about people too. So that empathy, curiosity, thirst for knowledge, to keep on learning, because medicine's changing all the time. Every single year, they come out with new guidelines. The ADA comes out with new guidelines. The American Heart Association comes out with new guidelines. You have to really love learning and being a student, because you'll have to read them and you'll have to stay up to date, and you'll have to, it's a skill and it's a practice. Medicine is and it's a practice. It's something that the more you practice, the more you do, the more proficient you get at doing too. So you have to kind of enjoy doing that, reading, a lot of reading and learning, a lifelong learner.
Sounds good. Thank you. We did have another question come in the chat. This person entered the Zoom meeting a little bit late, so they missed when you were sharing how you knew that you wanted to be a physician's assistant rather than a different career. You mentioned music and your love of music. So if you could speak to that again, just for the students' knowledge, that'd be great.
Well, briefly, I figure that out after getting experience in the medical field, to be honest, because before that, no idea what I wanted to do. And I worked at a skilled nursing facility, but I also worked at a hospital. I worked on a med surg unit as a nursing assistant. I worked at a rehab facility, so I got to see patients after their stroke and after their heart attacks or knee replacements, people that had like Guillain-Barré syndrome, which is this like really terrible neurological viral illness that causes like paralysis, and watch them rehabilitate, like learn to walk, learn to feed themselves again. So I had like trying out these different areas of medicine before I actually really settled in on like, I want to do PA and I want to be family practice. I also shadowed. I will say I talked with a lot of people. I talked with nurses that I worked with. They're awesome. I love my nurses. I love the nurses that I work with. They're great. But I would talk a lot with the nursing staff there. I would talk a lot with the physicians that were there. That as they would come in to round on their patients in the morning and ask them about, their life in medicine. I talked a lot to the physical therapists and occupational therapists that I worked with at the rehab center. And then I talked with some of the nurse practitioners and the PAs that I had I was fortunate enough to know a family friend that, had done, licensed for both. So I got to hear his perspective and get his perspective on that. So I would encourage anybody who's not really sure, but you think you want to go into medicine, start looking at an entry, something you could do entry level, whether that's scribing or EMT or CNA, or even like some hospices. Now it's harder now because of COVID-19 and everything that's going on, but there was a period of time where some hospitals and some hospice centers were allowing students to go in and do some hours, to volunteer some hours. And I remember at the community college they used to sometimes give credit for that kind of volunteer work type work experience. So I would encourage anybody that's kind of on the fence and not really sure to go do that, and then hook up, go talk to somebody who's in that field. If you want to know what it's really like to be a PA, go talk to a PA. If you want to know what it's really like to work as a nurse practitioner, go talk to a nurse practitioner. So don't be afraid. Most medical providers I know are people, they're people persons. They like to talk with people. So yeah, reach
Sounds
out.
good.
Mhm.
Thank you. Just for anyone that's on the call that's interested, Marilyn mentioned work experience, and we do have that same program at West Hills College Lemoore. When Marilyn's answering this next question, I'm going to be putting in the chat my email. If you're interested in getting more information about our work experience program, just send me an email and I'll email you back with some more details. Okay. So Marilyn, my next question for you, then as a physician's assistant, what's a typical challenge that you might experience on a day-to-day type setting as a physician's assistant?
Ooh. So typical challenges, some of the things that I talked about before, some of the socioeconomic barriers can definitely be challenging. You know, you want to prescribe a certain medication to a patient and they've tried a bunch of others and nothing's worked, but you know, they can't afford it or their insurance doesn't want to cover it. You know, those are always very challenging because you have to figure out a way to overcome. There's a lot of paperwork that's involved now. There is a lot of administrative type work that's involved, and that's with all medicine. You know, professions. I think the amount of paperwork and the amount of charting that is necessary in the field has gotten a lot. We have an EMR system. An EMR system is an electronic medical record that you have to notate everything. Everything has to be documented in there, and so those can be challenging when you guys, you know, people might have noticed they go to their doctor's office and all they see is the back of their doctor and their doctor typing away on the computer as they talk to them. So that sometimes that pull away from being present with the patient is hard. I think that has been challenging for me, at least, because I really enjoy talking with people, looking at them in the eye. And like I said, I've always enjoyed, you know, being interested in people's histories and stuff. It's really hard to do that when you're on a time crunch and you got things to type up and people need their paperwork completed. So that can be, I think, you know, a challenge. It's just something that is more challenging now. Billing and coding for the coding for you know, practice now, they use something called an ICD-10 code, which basically every single diagnosis you can ever imagine, like stung by a bee, you know, stepped on a rock, right knee pain, left knee pain, common cold, any diagnosis, heart failure, it is linked to a specific ICD-10 code that has to be, you know, charted on and put in the medical record. So keeping up to date on all those, the codes that needs to be, that, you know, you need to be kind of refreshed on, and then some of the stuff with the billing requirements and quality measure requirements. So you'll see that you know, they talk a lot about that, you know, with insurances now, that they're starting to move away from with something they call pay for service or fee for service. So they used to be, they would you get paid by seeing a patient, and now it's going more towards quality, you know, fee service schedule. So now they don't only want you to see the patient, they want to see the quality, you know, what in the population and the population's general health. So they will take a look at every single patient that I've seen for the year, and they want to see that anybody who's diabetic, that their A1Cs are getting better controlled. If they have high blood pressure, that all of the patients that I've seen with high blood pressure, that their blood pressures are now in control, that their medications have all been reconciled. So every single time they come in, every medication that patient has been prescribed, I either put whether they're still taking it, not taking it, you know, or if they're intolerant to it. So those are some challenges now that have, I think, put a little bit more pressure on the medical community as a whole, because we're having to fit a lot more stuff into a short, you know, visit. But you know, if you love what you do, you you deal with the challenges. That's that's the way it is. And there's challenges in every profession. So
very true. We did have another question come in the chat. I've heard this, the student has heard that physician's assistants enjoy flexibility when it comes to switching specialities. Would you consider that to be true?
it is the way you're allowed to work is you work under a supervising physician. So as long as that supervising physician has the skill set and is willing to train you, you can actually switch from, internal medicine or family practice to surgery. I've seen physician assistants do that. I will say it is getting a little harder to do that. You can still do it. In school, you'll certainly be exposed. I feel like a lot of the PAs I went to school with that went into specialty care, went into specialists, did some form of rotation in that specific field before they went and got a job in that field. So, but there is a lot of PAs now that are going into subspecialties, urology, nephrology, which is like kidney specialists, even radiology, surgery, trauma, emergency medicine is a big one. You'll see a lot of PAs working in emergency medicine and urgent cares. So yeah, definitely can do that. There's also residencies for PAs too. So I have one of my PA colleagues that I went to school with. She actually went to Johns Hopkins and did a 1-year residency in cardiothoracic surgery. So she for a year worked, no, more than a year. She worked for a couple of years at Stanford Medical Center, working with a cardiothoracic surgeon. So she would do the vein harvesting, the grafts that are needed to do bypass surgeries. But she did a specific residency for that. So you can do both options. You can go through a residency program to get formally trained after PA school, if that's something you want to do. Or while you're in school, you can go really, request a lot of clinical rotations or a lot of clinical hours in a specific specialty if you're really interested. Like another PA student I went to school with, he knew he wanted to be a cardiothoracic PA. He was an EMT before. He loved working with a cardiologist, even when he was a med tech in the emergency room. And so he went out and for his surgery rotation, he actually formally requested an additional cardiothoracic surgery rotation, which is crazy because it's so super hard and you never get to sleep on some of those rotations. So he requested more hours for it, and that's what he did. When he graduated, he went to cardiothoracic surgery. So yeah, you can definitely go into other subspecialties, and you do have the flexibility of moving from one specialty to another. I will say, caveat, it is getting a little bit harder to do that. Most specialties now, they're wanting to have a little bit of experience before they take you in or train you. And now there's even residencies if you want to do that.
We did have another question that came in the chat. What challenges did you face while in the PA program?
You can't work. That was probably the biggest challenge. I was so used as an undergrad. I would go on the weekends, maybe do a couple of gigs here for a wedding, playing music to make money, or working as a nursing assistant, doing a couple night shifts here and there. That, as an undergrad, so I was used to working and making money so that I could support myself. I was able to mostly pay for all of my undergrad without any debt, which was awesome. And of course, going to the community college, that really was awesome because I got to do that. The PA, you just can't, you can't work while you're in PA school. It's really hard. And so financially, that is something that you have to kind of consider. Like if you have a family, I didn't have any kids at the time, but my daughter was born after my first year of PA school. I had her like right in the middle of a winter break, like literally 2 weeks, and I was back in clinical rotations. I don't recommend that. But that those first 6 months of her life, I was there, you know, but I wasn't there as much, you know, as I would have loved to have been, you know, because you spend a lot of time in school, you spend a lot of time in the books. It's a lot of information you have to digest in a very short amount of time. It's only 2 years long. And then on top of that, you have rotations that are going at the same time. So your that family life work is just not possible. Like you're gonna have to you're gonna miss some things during that time. So that's
Mhm.
one thing that's hard about I would say about PA school is you're going to have a really heart-to-heart talk with your family and about the things you're willing to miss while you go through the program. It is grueling, it's challenging. It's only 2 years, but it's a challenging 2 years.
And during that time, the first year is that educational component, and the second time is the clinical, where you do that over 3,000 hours of clinical requirement, right? Okay. Sounds good. Yeah, that would be a lot. I could see that being a struggle.
Yeah, and that didactic coursework, it's it's a lot of information you have to digest. I mean, you're doing like pharmacology. So you're learning medicines, you're learning their mechanisms, you're learning about their side effects and how they affect people and how they affect different populations that may have certain medical conditions. You know, and you're also learning about their disease process, and you're also learning the pathophysiology, so all of the biology and the science behind that. So it's a hard year. You can do it. I mean, I went to school, like I said, I had my daughter after my first year of school. My second year of PA school was, with my daughter. And there were other PA students that were in my program that had kids while they were in the program, but I know that they got a lot of support, familial support from their spouses and extended family, the moms and dads and grandparents and uncles and aunts to help out while they were in school, because that was the challenge for me. You can't work, and you have to really dedicate yourself to it for those 2 years. Mm-hmm.
Do you feel like you had a lot of instructor support, and people like your instructors in the program, they were really supportive and you could go to them if you needed their assistance or if you were struggling in any way? Were they really supportive in the program?
Oh yeah, most definitely. I actually am Facebook friends with some of my professors that, went to school with. We still, even now, and I'm like 9 years out of PA school, and one of my actual faculty advisor just retired this year. And so, I remained in close contact with her. I've actually remained in close contact with a lot of my colleagues. I think because of the experience you go to, like I said, they become like almost like a second family. You spend so much time studying, you spend so much time together on clinical rotations, and you start sharing that information between students. Oh, you went to surgery, how was that rotation? Or how's that attending? Or how is it to work in at that hospital when you did that rotation? So you start sharing all this information with each other, and you end up becoming so close to a lot of your other classmates and a lot of your professors. They've all been through that. You'll find in PA school, most of the PAs in school, if there's something in medicine, whether they work in public health or background, or they were themselves like primary care or specialty care, they all have some form of medical experience. That's something also pretty unique, I think, to a lot of, well, no, I think a lot of medical professions, you'll be taught by people that actually practice too. And some of them are still practicing, they're still working at the clinic, and then they go and put lectures together and do teaching on the side. So yeah, you get a lot of support once you get into the programs. They want to see you succeed.
That's good. Thank you. So another question came into the chat while you were answering that question. Do you feel like is a stigma surrounding the PA profession?
A stigma? I'm not sure. I don't know if I think there's a stigma around the PA profession. I think you'll find some patients in general, sometimes you'll find people that have a general distrust of the medical community, just in general, like, they don't, they may have not had a lot of exposure with people in medicine, and like I said, you're sometimes working with people who don't always feel their best and who are sick, and so you'll kind of butt up against that. There is, I guess, and maybe this is more to the questioner, the person asking the question. There is sometimes a turf war, I will say, in between, working with patients, and maybe they have a specialist, and maybe they have a primary care, and maybe the specialist wants to do this, and the primary care wants to do this, and so sometimes, and they may say, oh, well, you're just the PA, so I don't know if that's necessarily like only in medicine or only for the PA profession. I think you kind of see that in a lot of other professions. You'll find that people don't like their toes to be stepped on. So, or they don't like to be questioned. And so, so that may be a little bit of a stigma for that. But no, I don't really find that very generally. Most of the time I go in and the patients, I always introduce myself as a physician assistant. They know who I am. I wear my badge. I'm always very honest. Every once in a while, I have a patient who's never had an encounter with a PA, and so they ask questions. And so I talk to them about my training and where I went to school, and I give them a little bit of information about some of the things that I worked on. I find that's more common in the older population, because I think they were not used to NPs and PAs and all these other type of professions. It's kind of newer, so I see that maybe more in people that are older, but not as much anymore. I think a lot of people have now, growing up in whatever interface they've had with the medical community, have had some care by an NP or some care by PA, so they have some general understanding of what a PA and NP are.
Okay, thank you. Another question that came in the chat is, what was the interview process like?
Okay, yeah, so the interview process is different at every single school. I actually, because I wanted to stay in California. As I mentioned, I was married, and my family's from California, and they're here from the Central Valley. So I applied to only I did apply to one school, Stony Brook in Long Beach, Staten Island, on the East Coast. But all the other schools I applied to were here on the West Coast, and different schools had a different interview process. Some of them, I would say most of them had some type of panel interview, followed by like kind of like a one-to-one with maybe like one or two faculty or student, members. And then that tend to be the way, and then like something like a tour or something like that. But the most of the interviews, I have to think back on that one because it's like a long time ago for me. But I remember doing a couple panel interviews, and I remember doing a couple one-on-one interviews, like both.
Okay, yeah. And that was for the program?
Yeah, for the PA program, yeah.
Okay.
So I applied to many in California, there's like, at the time there was like 6 or 7. There's a lot more PA programs now than there was back then, but I ended up interviewing at Western University and Davis, and then I got invited to interview at USC, but I had my heart set on the Davis program, and so when I got into that program, I kind of canceled the rest of my interviews, and then the one at Stony Brook, it was in the middle of winter, and I was I thought about it. I was like, maybe I'll try an East Coast experience. I never lived out of the state of California, and I was booking my flight, and it was like below freezing. And I was like, there's no way. And they were like rerouting flights and canceling. I was like, there's no way. I'm staying in California.
So then what was the interview? Was there an interview process for your actual career as a PA, and what was that like?
Yeah, so for the school itself, you have to submit a CASPA, that the application, and then they'll call you. Some schools require that you submit secondaries, and then the actual interview process for going to school. Yeah, they ask a lot of questions about like your educational background. Your medical experience was a big one. They want to know what type of experience you had with within the medical field. And then those were like big ones. Why do you want to be a PA? Why PA? Why not something else?
Mm-hmm.
So those were kind of the big, I would say big three topic areas that they went over.
And so then you didn't, in your current position at Kaweah Delta, you didn't have to go through an interview process?
Oh, for actual work.
Uh-huh.
Yeah. So yeah, definitely. Yeah. It, and the employers, different, depending. So I worked at a FQHC, which is a federally qualified health center. And then I worked at a private practice. I worked at an urgent care. And I now, work for Kaweah Delta, which is a community district hospital. And I would say each interview has been different because they're looking for different things. And so very similarly, when I interviewed at Kaweah Delta, at least it was panel. When I was at private office, actually in the private office, even it was a panel because it was a group of physicians that hired me to work. So a lot of panel interviews. And the type of questions they ask during the interview is not actually about medicine. They want to know what your soft skills are like. They want to know that you know how to talk to people, how to treat people. They want to see, the kind of things that you value, because medicine is becoming much more patient-centered, much more customer service oriented. And so they actually, a lot of those interviews were set up really to look at those soft skills. And they want to see what kind of person you are and the kind of provider you would be, and I didn't actually get asked any medical. They never said like, oh, you have a patient with high blood pressure, or what, you have this choice of medicine, which one do you pick? They never asked any questions like that. It's more kind of like, have you ever dealt with a difficult patient? Have you ever, had, had to, a difficult situation with a patient, or had to explain a loss to a patient? Or have you ever, how do you communicate with your team members? Or how do you resolve conflict with your team members? They care much more about those types of things.
Okay, thank you. And then the last question for the BizChat today is, what advice would you give to a student who's interested in pursuing a career as a PA?
The advice, I mean, I would say get some experience in the medical field, and then make sure that you do get good grades on your requirements, on your prereqs, because they're important, and really hone down that reason why you want to go into medicine, because it's going to help keep you going through not only like your undergraduate experience, but also your PA, education. You're really going to have to hang on to something. Sometimes are tough in that the amount of knowledge and that you have to learn. It's, like I said, very you have to learn things very quickly, and the amount of information you have to process and learn is a lot. And so sometimes it becomes overwhelming. But if you remember your why are you doing this? It helps. But yeah, getting that medical experience right now, if you're just starting out, start getting that medical experience and taking those prereqs and getting good grades. And then if you're a student, butter up your professors because you're going to need those letters of recommendations too. So, being, but that's all a part of also to becoming a good, a good learning to talk with people, learning to communicate with people, learning to interact. You got to start beefing up on those skills. Mm-hmm.
So thank you. Sorry, I forgot I was muted there for a second. I did ask Marilyn earlier when she and I were meeting to discuss this BizChat if she'd be interested in being a mentor for any students, and she did agree to that. She knows that sometimes it's hard to find people in industry to ask them questions about your experience, your education, so that you can excel in the career field that you're wanting. So I am going to put in the chat her email. If you are interested in connecting with her and asking her some questions that you weren't able to in today's BizChat, I put her email in the chat box for you. And then I also am going to include in the chat our regular survey link for you guys. So please fill out this survey. It's going to be right here for you. And it's going to take you to a different web page, but it's going to ask you just, I think, 5 questions on your experience in today's BizChat, wanting to make sure that the information shared with you today was helpful and beneficial for you, that you found this event helpful and good for your career exploration. And thank you, Marilyn, for taking the time. I know you are swamped right now, so I just appreciate you taking the time to meet with us today.
No worries. Thank you, guys.
Thank you, guys.